Hello and welcome to the Cancer Center's Community Conversations, our second week. I'm Chris Gay from the UI Cancer Center, the Office of Community Engaged Research and Implementation Science. Today our guest is Tamandra Morgan, second year medical student. Welcome, Tamandra.
Thank you.
Today we're going to be talking about genetic screening for breast cancer, and also Tamandra's experience with medical school and her road to medical school. So I guess we'll start off with that question. So Tamandra, what made you choose to go to medical school, and what was your road to medical school like?
Sure. Thanks, Chris. I'm really excited to be here. So my road to medical school was a little non-traditional, as they say. I studied human biology in undergraduate. I attended Stanford University. My first summer internship, I worked at a cancer center in Southern California, City of Hope Cancer Center. And it was through that summer research project where I was working with a medical oncologist who had a lot of experience with hereditary breast and ovarian cancer syndromes. And it really inspired me to go into pursuing genetic counseling. So I was working with genetic counselors, and we did a project where I realized that these services were available, and as we'll talk about a little bit later in this program, great ways to enact preventative measures to reduce your risk of developing cancers. But what we found through our data was that a lot of the minority patients were not pursuing these services. So for various reasons, whether they were unaware the services existed or their physicians didn't refer them to the services, there was definitely a clear disparity between who was pursuing these services. So I was interested in that from an academic standpoint, and I decided that I want to pursue the route of genetic counseling. So after I graduated from undergraduate, I attended a genetic counseling training program through Johns Hopkins and NHGRI training program. And I worked 2 years as a genetic counselor following graduation. And just being more involved with the patients, I realized that I wanted to have a deeper level of interaction with the patients. As a genetic counselor, you get patients once they're there, that once they've been referred and we're looking at their family history. But I wanted to catch those patients who were in a primary care setting before they even got to genetics, identifying them at an early stage in their care. So I was really inspired to pursue medicine after that point.
And have you been able to sort of focus on that track through medical school so far?
Yeah, so I just finished my first year of medical school, so in between first and second year right now, and I've been able to participate in a summer research project, which I am housed in the UIC Cancer Center, and just being able to continue that interest in breast cancer disparities. So I've been working with Dr. Kent Hoskins and Dr. Kareem Watson and looking at a project where we're trying to identify some of these factors that are going into why high-risk minority women aren't pursuing these genetic counseling risk services. Okay. So it's been a great journey, and I came into it with a specific passion. It's been wonderful to be able to continue to pursue it while I'm here at UIC.
Fantastic. And even just to dive into more, can you give us like a general overview of what genetic counseling is, how it's used in like the clinic setting and here at the Cancer Center, and maybe how it would be used in the community?
Sure. So a lot of people are unfamiliar with genetic counseling as a profession. So it's a healthcare provider profession in which these are individuals who work with patients who are at risk for a large amount of hereditary conditions. And you basically help people understand and kind of cope and adapt to these medical conditions. A lot of genetic conditions are these lifelong conditions that you might not be able to cure, so it's more so about managing and learning to cope with living with that condition or that risk for that condition. So we do a lot of interpretation of family medical history and personal health history, and helping patients to realize the risk of a disease to occur or reoccurrence of a disease that's in a family. And then we also educate our patients about whatever testing options might be available for their particular condition and help them order the test. And once they do order genetic testing, if they decide to pursue that route, what we do is we help them interpret the meaning of their test results.
Okay, fantastic. And so I guess, again, even going a little further, what's the major role that genes play in cancer, I guess? How, if someone went to the clinic and, they hear about it either here or at one of our community events about genetic counseling, how would you recommend, they start thinking about it, important factors on, thinking about genes in relation to any form of cancer?
Mm-hmm. So in general, cancer occurs as a result of a buildup of somatic mutations. So when I say somatic, that means mutations that aren't inherited. They occur in your body, and usually these mutations are in genes that are necessary to prevent accumulation and development of tumors. But we do know that, as you get older, age is a high risk for developing any sort of cancer. But what we do know about hereditary cancer conditions are that individuals might be born with an increased risk for developing a certain type of cancer. So with hereditary breast and ovarian cancer, two genes that you might hear discussed often are the BRCA1 and 2 genes. And these genes can be inherited from either parent, mother, or father. And if an individual inherits one copy of that gene that has a mutation in it, then they're at an increased lifetime risk for developing breast and ovarian cancer. And so it's these proportion of cancer cases that we talk about when we talk about inherited cancer cases. Only about 5 to 10% of all breast cancer cases are actually attributed to hereditary factors. So the remaining 95% are actually just cancer that occurs as a result of random mutations in our body. So with the inherited cancer cases, if we know that an individual is at risk for developing, or at an increased risk for developing these cancers, there are preventative things that we can do that might help to modify an individual's risk. So for instance, if you test people describe it as testing positive for a BRCA mutation. So what does that mean? Well, it means that we found one copy of that gene has a mutation in it, and that's going to increase your lifetime risk for developing these cancers. But we can do something about it, which is what I found to be very empowering. And I really appreciate the aspect of preventative medicine that genetics provides clinicians. So if you're at an increased risk for developing cancer, we can either increase surveillance. So instead of doing mammograms at a certain age, we can start you earlier. We can do increased surveillance through breast MRI images, which is a more specific way of looking at the breast. And we can also do what's known as prophylactic surgeries. So prophylactic is just a fancy term to describe something you do to prevent something else from occurring. So these prophylactic surgeries might look like mastectomies before you develop cancer, just to reduce your risk. You remove the tissue, and so you significantly reduce your risk. You can also remove your ovaries. So a prophylactic oophorectomy would reduce your risk of developing ovarian cancer. So there's a lot of ways that you can kind of reduce and minimize your risk once you know you are at increased risk.
Fantastic. I mean, thank you for that background on genetic counseling. And I guess this would also be a good time to go and look at the program that we actually have at UIC, the familial breast cancer program.
Mm-hmm.
Can you tell us a little bit more about it? Or
Sure. Yeah. So UIC has a familial breast cancer program. It's headed by Dr. Kent Hoskins and 2 genetic counselors, who I believe will be speaking with you all next week on this show. And it's a great place to go if you have a family history of breast or ovarian cancer. So when we say family history, we think about something that runs in the family. So if you have multiple relatives, maybe a sister, an aunt, a grandmother, a mother, and multiple relatives in different generations that have been afflicted with breast or ovarian cancer, that would be a good place to go to see a genetic counselor, so they can really take an in-depth family history and see if you might be a candidate for genetic testing. As I mentioned earlier, since only 5 to 10% of all cancers are attributed to hereditary causes, not everyone is going to be a good candidate for genetic testing. We want to really test individuals who are at that increased risk, or who have a high likelihood of being having a familial breast cancer syndrome. So if you want to set up an appointment with at the familial breast cancer program, you would meet with these genetic counselors, and they can take a pedigree of your family history and kind of let you know what they think would be your best options as far as pursuing testing and additional screening.
Fantastic. And even thinking about it, also sounds like you could generally just help people better understand what their familial history means,
Mm-hmm.
and just be more mindful of, if I have a family member that either, for breast cancer, my mother, my aunt, my great aunt, my grandmother,
Mm-hmm.
Just be more mindful of those things, because it can have an effect on your risk for cancer.
Exactly. And there, breast and ovarian cancer are 2 of the major cancers, but also there's other hereditary cancer syndromes there's certain colon cancer syndromes that would increase risk of developing colon cancer and some GI cancers. So if you have a strong history of any sort of cancer in your family and you want to learn a little bit more, a genetic counselor would be a great place to start.
Right. And you can find information about the Center for Breast Care on our website here through the University of Illinois UI Health website. You can connect to the Center for Breast Care. It has information about who would benefit from genetic testing, from genetic counseling, and just an overview, pretty much everything Tim Andrews said so far about genetic testing, what it is, and how it could help you better understand your personal risk.
Yeah, and there's certain features when we talk about who would benefit from genetic counseling for the familial breast cancer program, certain features that we think about when we want to refer. So on the website, they have a good rundown of that list.
And it looks like actually we have a caller with a question. Hello, caller, can you hear us?
Hi, how are you? Thank you for taking my call. This is really some good information that you all have on this show today, so thank you for this. I had two quick questions. One, it sounds like the guest, she mentioned some information about a pedigree. Can you tell me a little bit more about a pedigree? Because when I think of the word pedigree, I often think of something that you draw to show where your family comes from. So how is a pedigree? What is a pedigree? And how is it used to help me understand my family history in terms of health? And number two question is, this information is really, really helpful. Do you all go to other community venues to have these types of conversations? How can we get this conversation in front of other groups like church groups and faith groups and other community groups?
Sure. Thank you for your question. So I'll answer the pedigree question. So you're on the right track with that. A pedigree is this visual pictogram of your family history. So a pedigree can really be used to track any conditions that are running through the family. So what we would do, I'm not sure if we have any images available that we could pull up for you, but a pedigree would what a genetic counselor would do is they'd make a pedigree to show all the members of your family and who is affected with what. So we would shade in individuals who maybe have been affected with breast cancer so that we can have a visual image of how a condition is being transmitted through a family, how many generations are being affected, at what age are people being diagnosed with these conditions, and is it all female, is it all male, is it coming from the maternal side, so everyone on your mom's side, or is it coming from the paternal side, everyone on your father's side? So a pedigree really gives us a visual image to look at your family medical history and give us kind of a sense of what might be going on, what sort of conditions should we be concerned about. And it's really the best diagram that genetic counselors and healthcare professionals use to track conditions that have a familial basis.
And I can address the second question. The Cancer Center in our office, one of our main goals is to go out to the community and engage and connect this education to as many people around the community as we can. So part of that is we do connect with faith-based partners, with community partners all across the city to connect this information with them so that they can spread out to their community as well. So for instance, we have an upcoming event that we're going to be a part of, Hope Fest, happening in Humboldt Park with New Life Covenant Church. And at that event, we'll actually have a table completely focused on breast cancer. And there you'll be able to get more information about genetic counseling and genetic testing. And through there, we'll be able to reach a lot of people in the community, but some of the information we hope will pass on to a second level so that people we talk to at the community will talk to their other community members and even their churches, their faith-based partners and community members, and continue to pass on that information. And if you have any questions about the events we're going to, or where we're going to be over the next, the rest of this year, the different events we engage in, you can go to contact us with this information at the Cancer Center phone number, 312-996-8503. And this is the Cancer Center website. And at both of those places, you can find what events we'll be engaging with and where you can get more information about genetic counseling and genetic testing specifically. But really, we cover a lot of Cancer Center education, and cancer screening. And thank you so much for your question, caller. That was perfect to get into some of that information.
And I would just add that, one of the best places to start when you're thinking about, well, am I right for genetic counseling and testing? I don't know a lot about my family history. I don't know what I'm at risk for. Sit down with your family and your relatives and just have a conversation. Sometimes that's the biggest hindrance, that a lot of families don't openly talk about conditions that afflict them. They don't want to discuss kind of these negative topics, but it's important and empowering to really have discussion with your family, relatives, and let other generations know, like, this is what people have been affected with, and this is what you might be at risk for, and so here's this information, and you can use that to really empower yourself and to take control of your personal health. So I would encourage just to have those conversations, reach out to relatives, and you can become the own historian of your own personal health history and your family history.
Right. And I mean, pertaining specifically with genetic counseling, that's very important, but also opening the conversation about cancer overall, I think, is one of the main goals of the Cancer Center, making it easier to talk about in the communities. And I believe we have another caller. Caller, can you hear us?
Hello?
Hello? Can you hear us?
Hello?
Yes, we can hear you.
Yeah, we can hear you, caller. Did you have a question?
Yes, hello. My name is Jamila Morgan.
Hi.
Hi. Did you have a question for Tamandra or myself?
I do. I'm sorry, there was a delay in the call.
it's all
I was
right.
just wondering
No
if Tamandra could talk about coverage options for folks that are insured, if they could get access to genetic testing free of charge, and what other opportunities would be available for persons who maybe don't have insurance.
Yeah, thank you, Jamila, for your question.
Thank you for your question.
So definitely with the Affordable Care Act, individuals who we identify as being at this increased risk for these conditions, they have a strong family history. So as I mentioned on the website, it kind of lists those parameters of who would be a good candidate for genetic testing. These tests, the cost of this test and the cost of genetic counseling services are very often covered by insurance as a result of the Affordable Care Act. So these are services that your insurance will cover the cost of. They are very expensive tests without insurance, unfortunately. So your insurance provider will cover it if you are a good candidate. So that's why it's important to have your family history information available so that we can really sort through and determine whether or not you're a good candidate for that. As far as individuals who might not be insured or anyone who wants to pursue testing otherwise, sometimes there are available research studies where you can participate in, and they provide free of charge testing. So one ongoing study right now is called, through the UIC Cancer Center, is called the Heritage Project, and that's particularly for high-risk African American women who are either breast cancer survivors or have a family history of breast cancer. And by participating in this study, they can pursue genetic counseling and testing free of charge.
And specifically talking about the Heritage Project, we do have at most of our community events navigators for the Heritage Project. And so at many of our events, if you are interested in more information about it other than calling our number or contacting us on our website, you could also see us at our events where we'll have a navigator who can help you engage with those different projects. Thank you so much for your...
Thank you both.
Yeah.
You're welcome.
Thank you for your call. And so even thinking about, we can go back just to talk more about, because you did mention again sort of who would benefit from this testing.
Yeah, and just some of the factors that you want to consider about breast cancer at an early age. So we define early as kind of before the age of 50. Individuals who have 2 or more breast cancer, so maybe breast cancer 1 year, and then a few years later they developed a new primary, that would also be suspicious. We also mentioned earlier multiple generations affected by breast cancer, so cousins, aunts, and grandmothers, any sort of family history where you see multiple people are being affected by similar cancers, that would be a good warning sign and a strong indication for pursuing genetic counseling and testing. If you can get a referral to a genetic counselor through your primary care provider. Alternatively, there is a wonderful website, an association, the National Society of Genetic Counselors. Their website is nsgc.org, and when you go to that website, you can click click on a link that says Find a Genetic Counselor, and they can pull up a genetic counselor within your geographic region. So that's a good place to start if you're not sure how to get in contact with one.
And again, you can always contact the UI Cancer Center. We, of course, connect you with our services, but also we have partnerships with multiple clinics around the city and state. So we can connect you with your closest genetic counselor, whether it's at the cancer center or somewhere, within your community.
Yes.
And to just continue some of the conversation about, why do you think it's important to bring genetic counseling out to the community? One of the goals of the Cancer Center is to take, specialty care services back out into the community and re-engage it with the community so that it's more accessible, but also so that people have a better understanding and education of cancer and health in general. So what do you think is super important about genetic counseling and why we should bring it into the community?
Yeah, so I really believe that genomic medicine is the future of healthcare. It provides you with the ability to really engage in preventative medicine, and by that I mean identifying people who are at risk and identifying them at an early stage, and really giving them information that they can use to either reduce risk or to take control of their health. So the only way that we all can benefit from these services, if we're all aware of it, if we're all provided with equal access to it. So one of my main reasons for pursuing medicine was just to really make a difference in these disparities that exist across healthcare. And particularly, as I mentioned earlier, that there are clear disparities in the type of patients who access genetic counseling and testing. And because these services can be so powerful in a role of preventative medicine, I really want to see, the level of knowledge and awareness among minority communities, particularly increase, so that they know about these services. And if their doctor doesn't refer them to them, they can ask during a visit with their doctor, hey, do you think I might be a good candidate for genetic counseling, genetic testing? And empower yourself. If your doctor doesn't refer you, or if your insurance isn't participating with you, you can go online and call up a genetic counselor, and they will help you facilitate the necessary process. So I would definitely say take it upon yourself to learn more. There's great resources out online. One particular website is rarediseases.info.nih.gov. It's through the National Institutes of Health, and they provide a wealth of free information about various genetic conditions and disorders if you want to learn about anything and get a little bit more resources for yourself.
Can you say the website one more time?
Sure, it's Rare Diseases with an S at the end, .info.nih.gov. And the name of the website is the Genetic and Rare Disease Information Center, GARD for short. It's a great place to start if you're beginning your research.
No, it's fantastic. And I think it is important to know, as a main goal of the Cancer Center is to bring resources back into the community, but also to empower people in the community to accept, use the resources that are available to them and that are already out there. And we've had these breast cancer resources for a little while now. We're bringing it into the community, and we've had the Heritage Project for a few years now. A couple years, I believe it started in 2014, and still having people engage with it and use it is very important. And there's still a lot of communities that we can reach out with it and that can use it. And I'm excited to see where it goes, and how projects like this can positively affect our community.
Yeah, I'm excited as well. I think if you're interested at all in being involved in research and learning a little bit more, just feel free to use these resources online to find clinical studies that you might want to be a part of. And one thing that we do know about genetic testing is that we don't have as much data on minority populations because they're often not included in research studies. So if you want to contribute to the basis of scientific knowledge, that'd be a great way to start too.
And just again, if you have any questions about the UI Cancer Center or any of our resources, anything that we've said today on our programming, you can go to the Cancer Center website, cancer.uiillinois.edu, or call us at 312-996-8503. And also we would like to thank a few people for the production of this show. Don Smith, our communications director at the Cancer Center. Thank you again for coming to Mandra on our show today.
Thanks for
we
having
will be
me.
continuing our conversation next week about genetic testing. Again, I'm Chris Gay from the UI Cancer Center. Thank you very much.